45 minutes. Please click the arrow to proceed. Always remember, proper first aid can save a victim's life. First aid also can prevent the development of additional medical problems that might result from an injury or illness. Now, let's look into the health and safety statistics of Great Britain for the year 2016 from the Health and Safety Executive. During the year 2015-2016, about 1.3 million workers suffered from a work-related illness. About 0.5 million workers suffered from a work-related musculoskeletal disorder. This could be back pain, work-related upper limb disorders as a result of repetitive tasks such as display screen equipment use, checkout counter operations, and bricklaying. $0.5 million workers suffered from work-related stress, depression, or anxiety. 0.6 million of non-fatal injuries had occurred, wherein workers are seriously injured, which could have been potentially fatal. During the year 2015-2016, 144 people had lost their lives while at work. Financially, £4.8 billion was the cost to Britain against workplace injuries and illness. In this session, we will now look on to UK first aid regulations. Please note that every country is regulated by its own legislation, and that needs to be considered when put into practice. In the event of an injury or sudden illness, failure to provide first aid could result in a casualty's death. A first aider has a duty of care towards his casualty, to exercise reasonable care and skill in providing the first aid treatment. It is the responsibility of an employer that an employee who is injured receives immediate medical attention. The Health and Safety First Aid Regulations 1981 require employers to provide adequate and appropriate equipment, facilities and personnel to ensure their employees receive immediate attention if they are injured or taken ill at work. These regulations apply to all workplaces, including those with less than 5 employees, and to being self-employed. Every employer is required to carry out an assessment of their first aid needs. To determine what first aid equipment, facilities, and personnel should be provided, the following factors are to be considered. Every employer is required to carry out an assessment of their first aid needs. To determine what first aid equipment, facilities, and personnel should be provided, the following factors are to be considered. Workplace hazards and risks, the size of the organization, and other relevant factors. Where an employer provides first aiders in the workplace, they should ensure have an appropriate first aid qualification, Now, let's look into some review questions. Please select. As per the Health and Safety First Aid Regulations 1981, the regulation applies to all those companies with less than 5 employees and to the self-employed. Please select true or false. Now, let's look on to some of the important roles of a first aider. The role of a first aider is to give immediate care, while making sure that they and anyone else involved are safe, and that they don't make the situation worse. We will now look into the 7 important steps that you need to do if you think someone needs your help. Firstly, before you approach the victim, assess the situation quickly and calmly. Are there any surrounding dangers? Is it safe to approach? What could be the injuries? What's the age of the injured person or personnel? How did the accident happen? How many casualties are there? Secondly, ensure that you always protect yourself first. If you are unable to make the area safe, call for additional help. Move the victim only if necessary under a situation which could cause more harm to them. Next, ensure your safety in any case of infection between you and the victim. Ensure to comfort the victim. Introduce yourself to the victim. Explain the situation to the victim and give him assurance. Say what you will be doing to the victim before you do it. As the next step, give first aid treatment. Arrange for additional help if advisable to do so. Call for an ambulance or police services if required for further assistance. Stay with them until you can leave them in the right care. Now, let's look into some recap. Please select the correct answer. Once you have selected the answer, click the arrow to proceed. Click the next button to start the quiz. What is the definition of first aid? A. A procedure or policy to be maintained by every company as per the Health and Safety First Aid Regulations 1981. B. An immediate care given to a victim. C. Process of maintaining a fully equipped first aid box. Please select the right answer and click the next button to proceed. Now, let's look into some recap. Please select the correct answer. Once you have selected the answer, click the arrow to proceed. Now, let's look into some details about first aid box and its contents. The minimum level of first aid equipment is a suitably stocked and properly identified first aid box. Every employer should provide for each work site at least one first aid box supplies with sufficient quantity of first aid materials, depending on the size of the working environment, and if required, additional first aid box to be provided. First aid boxes have to be easily accessible and preferably placed near to a hand washing facility. Let's now look at what are the items to be included in a first aid box. It's important to have a well-stocked first aid box so that we can deal with minor accidents and injuries. Always remember that depending on the size of the workplace, the contents of the box could change. Let's recap this section once again. Please select the correct answer. Once you have selected the answer, click the arrow to proceed. Click the next button to start the quiz. Select the items which should not be included in a first aid box. Please note that you could select multiple items that would seem to be the correct answer. Once selected, please click the next button to proceed. For an individual to demonstrate their competence in first aid, they should hold a certificate upon completing the required first aid training. As per the Health and Safety First Aid Regulations 1981, Emergency First Aid at Work or EFAW and First Aid at Work FAW, they should meet the ends of the majority of businesses and remain the building blocks in the provision of first aid at work training. However, employers have the flexibility to choose whatever level of first aid training is appropriate for their business need and circumstances. Now let's ascertain on how we can assess the situation of a causality. If you think someone needs your help, before you act, you need to check if the situation is safe and easy to access. These checks can be broken into two stages. 1. The primary survey. 2. The secondary survey. Let's now look into details of how these surveys are carried out. Primary survey. This is a quick way to determine if someone has any injuries or conditions which are life-threatening. If you follow each of the steps methodically, you can identify each life-threatening condition and deal with it in order of priority. Consider the acronym Dr. ABC. D. Danger. R. Response. A. Airway. B. Breathing. C. Circulation. Now, click on each of the topics to learn more. After understanding each topic, click the Close button to go back to the main menu. If someone needs help before you attend the victim, you need to ensure that the area is safe for you to approach. For example, if If you can see or hear any danger nearby, like broken glasses, live electricity, oncoming traffic, then make the situation safe and then consider approaching. If you cannot ascertain to make the area safe by yourself, call for assistance. Consider the acronym Dr. ABC. D. Danger. R. Response. A. You can also ask them, "Can you please tell me your name?" For adults, pinch their earlobe or gently shake their shoulders. For child, tap their shoulder. For baby, tap their foot. Check if the victim's airway is clear. If yes, the victim's airway is clear and open, then move on to the next stage, which is breathing. If no, and the victim is responsive, then treat them for conditions that may be blocking their airway, such as choking. Remember, only move on to the next stage, which is breathing, once their airway is open and clear. And if the victim is unresponsive, tilt their head and lift their chin to open their airway. Consider the acronym DOC. Check if the victim's airway is clear. If yes, consider If no, and the victim is responsive, treat them for whatever is stopping them from breathing. For example, an obstructed airway. Remember, it is only after this that you need to go to the next step, circulation. At this stage, you need to start giving chest compressions and rescue breathing, which is called CPR, cardiopulmonary resuscitation. We will study in detail about CPR in the coming section. If CPR has started in this stage, then you probably won't be going on to the next stage, which is circulation. Consider the acronym. Check for signs of any severe bleeding. If you find any signs of bleeding, control the bleeding with your gloved fingers, dressing, or clothing. You need to call for ambulance at this stage or use someone's help to do the same. At the same time, treat them to reduce the chance of going into shock. If you don't find any bleeding and you haven't found any life-threatening conditions, then you can move on to the secondary survey to check for any other illness or injuries. Consider the acronym. Now let's look on to some revision questions. Please select the correct answer. Once you have selected the answer, what is the best method to check the response of a baby? In this survey, you can start asking the victim about what happened, how did it happen. You can also check with him or anyone near to him for any kind of illness or injuries. You can also note all these points to hand it over to the emergency services. Try to find out the below 3 items: history, symptoms, signs. You can ask the victim to describe exactly what happened, leading up to them feeling unwell or injuring themselves. You can ask other people near the scene too, and also look for clues. For example, if they've had a car accident, the impact on the car will help you work out what type of injury they could have. Ask the victim about any allergies they may have. Are they into any kind of medication? Did they already have any pre-existing condition? When did they last eat any food? What happened in actuality? Check the casualty over from head to toe, using all your senses. Look, listen, feel, smell. Remember, you may have to loosen, open, cut away, or remove clothing. Ask their permission to do this and make sure you are sensitive and discreet. Nose. Is there any blood or clear fluid coming from the nostrils? This could mean a serious head injury. Mouth. Check their mouth for anything which could block their airway. Look for mouth injuries or burns in their mouth and anything unusual in the line of their teeth. Neck. Loosen any clothing around their neck to look for signs like a medical warning medallion or a hole in their windpipe. Run your fingers down their spine without moving it to check for any swelling, sensitivity, or deformity. Skin. Note the color and temperature of their skin. Pale, cold, clammy skin suggests shock. A flushed hot face suggests fever or heat stroke. A blue tinge suggests lack of oxygen from an obstructed airway, poor circulation, or asthma. Chest. Check if the chest rises easily and evenly on each side as they breathe. Feel the rib cage to check for any deformity or sensitivity. Note if breathing is difficult for them or painful in any way. Collarbone, arms, and fingers. Feel all the way along the collarbones to the fingers for any swelling, sensitivity, or deformity. Check they can move their elbows, wrists, and fingers. Arms and fingers. Check that they don't have any unusual feeling in their arms or fingers. If their fingertips are pale or grayish blue, This could suggest their blood isn't circulating properly. Also, look for any needle marks on the forearms which suggest drug use. Spine. If they've lost any movement or sensation in their legs or arms, don't move them to check their spine, as they may have a spinal injury. Otherwise, gently put your hand under their back and check for any swelling or soreness. Legs. Check the legs for any bleeding, swelling, deformity, or soreness. Ask them to raise one leg and then the other, and to move their ankles and knees. Toes. Check their movement and feeling in their toes. Compare both feet and note the color of the skin. Grayish-blue skin could suggest a problem with their circulation or an injury due to cold like hypothermia. Now, let's look into some recap. Please select the correct answer. Once you have selected the answer, click the arrow to proceed. Click the next button to start the quiz. To check the victim's medical history, we can use the acronym AMPLE. Please select the correct definition from below. Once the answers are selected, please click Next to continue. The ideal time to call an ambulance is, and the important points to be kept in mind while calling. Before a call has been made to an ambulance, you need to assess the causality first. As we have seen above, by following the steps of primary survey, we can decide whether there is any life-threatening or any other serious conditions. If the area is also not safe to access the causality, then call the ambulance straight away. If someone's condition isn't serious, then you need to decide if they need treatment or not, and what options are there. For example, to drive them to the hospital or to call their doctor's surgery for medical advice. Before a call, once your line is through to the emergency center, please a description of the location that you are calling from, a phone number to call you back, details of any hazards such as any gas leak, fire, any live electricity, etc. In this session, we would study about CPR, cardiopulmonary resuscitation. When someone looks like they are asleep, but they are unable to respond to noise or body contact, it's likely that they are unresponsive. Unresponsiveness can last for a few seconds or for a long time. It's often brought on by serious illness or injury, or from taking alcohol or other drugs. You need to deal with someone who is unresponsive and breathing differently from someone who is unresponsive and not breathing. Now let's look into the different steps of doing proper CPR. Step 1. Open the victim's airway. If the victim is unresponsive, open their airway. Place one hand on the victim's forehead and two fingers under the chin. Gently tilt their head back and lift their chin. Step 2. Check their breathing. Maintain the head tilt and chin lift. Look for chest movement. Listen for normal breathing. Feel their breathing on your cheeks. If they are not breathing, you need to start CPR straight away. Step 3. Call for help and start CPR. Call for help on your emergency number, usually 999 or 112 or 108, or as applicable in your country. CPR involves giving chest compressions and rescue breaths to keep their heart and circulation going. Now, let's look at the steps of doing CPR.